The Oxford vaccine has been doing large trials, and what they've reported recently is that the human safety trials they've done have indicated that there are not significant side effects, and they've also indicated that they are stimulating a reasonable level of antibodies, and they've been able to identify what sort of regimen they would like to try. But they still have to do a very important step, and that's try it out in the real world. That is, give it to people who are exposed to the coronavirus or who are potentially exposed to the coronavirus. So you need to do those trials in places where you've got a lot of transmission going on. And it's that stage that's actually where we will know whether we've got a vaccine that can protect or not. And this is a stage that's very, very tricky. It's quite often difficult to get that evidence, and it means that, yes, they're moving along at a terrific pace, but we haven't got to the stage where we can say that we have a vaccine that we will be ready to use widely yet.
And I understand that normally a vaccine trial takes a decade or more from beginning to end. What do you think has changed with the COVID-19 trials?
You're quite right that most people would say 10 years is really, really, really good. So to be here 6 months into an outbreak with a pathogen we knew nothing about, we've got no experience of, completely new, to be at a stage where we have 21 potential candidates in human trials is unprecedented. I keep using that word, but I can't think of another word. There just isn't an example in human history. But it still takes, the next steps are the slower steps. So people who are thinking there'll be a vaccine by Christmas are wrong. We will be vaccinating ideally if we get a vaccine that is proven to be successful, possibly next year, but we're not looking at, and even then, all the public health interventions we know work must be applied. We cannot rely on a vaccine as the only thing that will end this outbreak.
So we can't rely on a vaccine, but with 100 plus trials underway globally now, how hopeful are you?
I am tremendously hopeful because of this incredible scientific goodwill and commitment. The people who are doing this work are not sleeping. They have just been round the clock because they know that they are the people who, their work is the work that's needed to provide one of the most important tools to save the human race from this virus. I said before, there are other things that need to be done. But this work, this commitment, and this sharing of knowledge means, for me, brings enormous hope, because this shows when we work together as humans, we can beat anything.
You sound encouraged. But do you think COVID-19 can be beat without a vaccine?
Yes. We've had lots of examples of outbreaks that have been stopped without any vaccine, without even any specific therapeutics. And I'm thinking of Ebola. Up until the large outbreak in West Africa, that was managed with no vaccine. And those outbreaks were stopped using the classical public health interventions, good testing, good contact tracing, good treatment, isolation of people who were ill, quarantine where required. Those things worked, and that's why we do know, even with something as deadly as Ebola, it can be done.